Afterwards, he slams.
Oh, your body's not supposed to bend backwards that way. Bone snapping breaks, spine crushing collisions, and what in the head trauma is happening here? In honor of the big game kicking off, today we're reacting to some of the most brutal career-ending injuries in the NFL. Let's dive right in.
Here comes the blitz. And there goes Alex Smith down at the 40-yard line. Kareem Jackson.
Oh, listen, I see these things come into the emergency department after they've occurred. We see them splinted. We might even see them with their bones sticking out of the skin. Watching it happen, I'm just like every other human. It's still intense. Uh-oh. That leg did not seem like it bent in the right position.
Nobody blocked him up to the front side.
Oh. This is most likely a mid-tibia and fibular spiral fracture, meaning both bones of the lower extremity on that right leg. Uh-oh.
This is what happened to Alex Smith.
Oh, look at that right leg. In the immediate treatment of this needs to be stabilized in as much of normal anatomical alignment as possible. Always an issue relating to pulses or not. It's always good to take off the shoe so you can actually feel distal pulses of the foot.
There is McLaurin. He's got a seam and has a first down. Terry McLaurin. Best year of his
somebody
career
down.
in his 6th year in the league. 13 touchdowns for him, and that'll move the chains. And already we have an Eke Robertson, who has been playing great on the outside.
You could tell that that humerus is not in the right position. Just the way that it's laying there.
Already so thin.
That left arm.
He got his arm kind of sandwiched in here. His left arm by Jack Campbell. Oh, goodness.
We worry about mid-shaft fractures because of the major vessel that runs on the inside. So you can do your brachial pulse by pushing your hand against your bicep here. We worry about fractures in this area because it can lacerate the artery.
Pressure. Tua steps up. He's going to run for the first down.
Oh.
Takes a shot at the 6-yard line.
We see a lot of head injuries in American football. Always concerns your brain rattling around, long-term effects of traumatic brain injuries. He ended up going to the hospital, I believe, was diagnosed with a concussion. A concussion is basically a clinical diagnosis. You're not going to get an image and say, okay, you have a concussion. The point of the imaging is to rule out intracranial bleeding. Oh.
Picked up the first, split the seam, but pays the price.
How long does the symptoms of a concussion last? Nobody knows. Could be a day, could be a week, could be months, could be years. There's something called post-concussive syndrome where you continue to have dizziness, feeling off balance. They may last for a long time and you need to be seen by a neurologist and continue to be evaluated.
And the safety, and I believe 31 right there, Cam Chancellor.
Loose after the catch, but Anthony Hargrove, number 94, coming in afterwards. He slams.
Oh, your body's not supposed to bend backwards that way. Johnny Knox.
Hi, I'm Johnny Knox.
Ended up having a thoracolumbar injury, meaning where the thorax and the lumbar areas of the spine meet.
Earl Thomas.
Oh no.
After Johnny Knox caught it and lost it.
Oh no.
Johnny is down.
You're gonna have impairment from around that area, give or take up and down. Everything below that's not gonna work as well as it should. Had intensive therapy, spinal fusion, hardware put in the back. Knox did not recover fully. He's able to walk, thank goodness, but walk with a limp and mobility is significantly impaired.
Ports is injured on this 4th and 1 carry, and it was the right knee. In a lot of pain.
He has a right knee cap dislocation, aka the patella. Kind of a common injury. The patella is a very small bone that sits in a nice groove relating to your knee.
And it's like they almost
Nice work. Very smooth, and that's what we would do in the emergency department. You're pushing medial pressure and then upward pressure on the patella at the same time as extending the leg for like a split second. It hurts and then it's back in place. Oh, Brady. Oh. Oh, he's down already. Seeing these injuries reminds me, if your body has ever been through wear and tear, you need good sleep to recover. Definitely check out Do Not Disturb by my company, Life Happens. Find it at lifehappens.com or on Amazon.
And Tom Brady got hit right on the knee.
Oh, it's a fumble.
Kansas City came
up
with the ball, but that's not the story.
His knee, no good.
Brady took a tremendous hit.
An injury of the terrible triad. That's a lateral injury pushing the knee medially, causing an ACL tear, an MCL tear, and typically a medial meniscal injury. These are the ligaments that keep the structure of the knee.
You can see it flex.
Oh, ouch.
How awkwardly.
Doing an x-ray doesn't really help identify any of the ligaments. It will help with, say, a joint effusion or if there's any fractures. But you need an MRI of this knee. Do you need an MRI immediately, emergently, that second? No. Majority of the time, you don't actually end up doing emergent surgery right then and there. Oof. Oh! Why would you do that? The face bleeds a lot. There's so many blood vessels there. Helps reduce infections, helps heal faster. Like literally, we'll suture somebody's face laceration closed and have the sutures out in 5 days and it still stays intact.
I look like a psycho. I'm just gonna keep my helmet on for the rest of the game. Yeah, I'm the smart guy, the headbutt someone with no helmet on.
Could he had an abrasion versus, laceration? They might have sewn him up. Would we recommend going back to playing? As a physician, I'd say no. But again, it's also up to the rules of the NFL as well as what the patient wants to do.
Tries to tuck and run, gets out of the first wave, throws on the move. It's complete as he hits James Washington. Mason Rudolph keeps
Washington's
it alive,
good. Oh,
but Rudolph is down.
Unconscious. Airway, breathing, circulation, those are the biggest things you worry about right away. We see his chest rising and falling. He's breathing, airway's intact, so it's not like there's the concern of like a tongue in the way, tongue bite, or bleeding in there. Scary.
He is out.
Not good. Breathing, you can see he's breathing, which is good. You're trying to wake this individual up, but you don't want to move their head very much. You want to keep that stabilized because you're not sure if there's a cervical spine injury. The patient's not awake to tell you if they have neck pain. Make sure they have a blood pressure, good pulse. Make sure their airway is open.
Got hit from the behind by Carr and appeared in front by, is it Jefferson?
Oh, just hit in the right place. People sometimes will get hit in the face to the jaw and get their bell rung and get knocked out. He also hit his head going down because he wasn't protecting himself. You see the hand spasm, the neurologic process. He's not shaking. Sometimes when people do pass out, you can have almost like a hypoxic type shake. It's not necessarily a seizure. Football injuries are always very intense. American football is very physical, and so a lot of injuries could happen. These are big individuals and very strong, and basically you're hitting bodies. And so you see these injuries in American football, you see them in rugby, any type of contact sport. If you guys, have had any gnarly injuries, let me know in the comments. And as always, do me a favor, check out this playlist right here, binge watch everything, and make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.